relations and friends and community members all talk about Obio all the time. So I'm really proud of what we've done with the Obio health insurance scheme.
The best thing you can do in a place is to make sure that you have the right people to give the right service.
I used to think it was just a small clinic, one small health center, but when I came in, it was really a big place. People come from as far as Eleme to this place. I think it's because we can offer them good health care at very cheap rate.
And when you have integrity and right attitude, you can do anything. A team that believes that everything is possible. In Obio, nothing is impossible.
My Obio story started in 2006 when I came into Shell, and I was just having a conversation with my then boss. We were supporting 27 health facilities in 6 states of the Niger Delta.
Government should not really take credit for starting it. The community, the Obio community, did have a memorandum of understanding with SPDC. And there were several things SPDC was doing for them in the health sector. And one of the things they proposed at the time was to provide support to Obio Primary Health Center. That's what it was at the time. And the kind of support SPDC was providing on behalf of the community was to provide extra drugs, medicaments, and then pay some extra stipends to the health workers who were there, to get the best out of them, make them more dedicated to doing the work. So that was going on even before 2010.
We had been supporting health facilities over the years. And what was the next step? These health facilities were mainly in hard-to-reach areas of the Niger Delta, where people really don't have access to care. So, but the next level was we had worked on something about access. So people now had health facilities close to them, even in riverine areas. But apart from access, another barrier was financial access. So you still had the poorest of the poor who could not access healthcare. Then the conversation of universal health coverage just started happening. The conversation on quality of care also started happening. And we believe that we could be the catalysts and a force for good in our milieu, in our microcosm, to see how we could get healthcare to people in a financially sustainable manner.
We went to the government and we told them, we shared the dream with them. And the government said they had no money and that they wouldn't be able to bring in any fund into the project. But we told them that, look, what we wanted from you was political support and to come out clearly to say that this project was not in any way against the health policy of the government, and for you to come out on that day to be part of the launching. So we took deliberate steps to make sure that the quality of the program, that of the service that have been rendered by Obio compares to whatever you would get anywhere else. And for you to be able to deliver that quality service, you need to focus on the staff. We talk about client-centered approach. We took a different path. We use what I call staff-centered approach.
In Nigeria, maternal deaths were still happening with simple deliveries. How could we actually get the people to come to the health facilities to access care and to be able to pay for it? And that's where community health insurance scheme came into our heads.
Technically speaking, is a PPP thing. The public, the private, and government. Yeah. Oftentimes, or the ones we've done, the government is usually the owner of the hospital, and we are involved. So we have the facility management committee, then the steering committee, which inputs the community technical advice from the private sector, and input from us, the government. That's what makes up the steering committee, and that's generally basically the setup across the other ones.
For us as a company, it's about being good neighbors. So we just don't come to do business and walk away. We also bring a lot of value to whatever environment or society we come into. So if you look at the Niger Delta and Nigeria, one key area where we all need to really work together to improve is health. So it's SDG number 3. It's really important to all of us, and for us as a company, as SPDC, Skin, we really have to play a role. So Obio is for us a model.
It was now in 2010 that the Obio community reached an agreement with SPDC to take it a notch higher than what they were doing and go beyond just supporting the facility and actually take over the facility. But SPDC didn't have that policy of, taking over facilities. So they had a discussion with us that they will want to support the community further by introducing a health insurance scheme.
Okay, so the community health insurance scheme started in 2010. But prior to 2010, we had the discussion with the former community health, regional community health manager, Dr. Babatunde Fakoli. We're looking at some of the issues that hinder access to care in our community facilities. And one thing that came up very strongly was that financial access was a major challenge to health care, access to health care in Nigeria. It's not only in the Niger Delta, it's everywhere in Nigeria. I was thinking about what can we do?
How could we use some of these facilities to deliver community health insurance scheme? Yes, we could say, yes, we will pay for everybody. But also it was key for any activity to be delivered. It must be sustainable. We did not want a failed project, and we wanted a sustainable project. So we sat down and we started looking at all our modalities, our community members. We had to bring everybody into place. Had conversations with the Ministry of Health, with our government, and then we had conversations with our communities.
The IA Cluster Development Foundation is a developmental organization. It's community-based. It's comprising 4 communities within the Obio local government that are host communities to Shell Industrial Area in Port Harcourt. These communities are Rumu Obiakani, Rumu Izolo, Ogineba, and Romasi. The people were not informed even on how to reach out for quality health care.
Around then, we looked at one of our structures with working with the community, which was the Global Memorandum of Understanding, which we call the GMOU process, where communities of like passion, communities that had the same trade, communities that spoke the same language, communities that just had like passion, we'll be clustered together, maybe 5 communities, maybe 10 communities, maybe 8 communities, and over 2-3 years, we'll look at their felt needs. They will get some amount of money, a pot of money, and then they will run their development. And we felt we could use the GMOU structure to run the development of this community health insurance scheme. And that's where it was born.
While we were thinking about that, interestingly, we then had a visit from the Obio, the Shell IA Cluster Development Board. So they came to say to us that they had some money. They had been given money under the GMOU scheme. And they wanted to see what they could do. Should they go and renovate the hospital?
First, you need to understand first that the facility upon which the community health scheme was going to be carried out was owned by local government, which is Obio Health. Fortunately, Obio Health is within the community.
When the need came for us to have a health center then, they were searching for land and whatever. So it was my late father, His Royal Highness, Eze Christopher Obondai James Wapara, blessed memory now. So he was spearheaded on his own to donate the land.
The entire thing was actually supposed to be a pilot. If it goes well, then we can think about, upscaling it elsewhere. So that is how essentially it started. This story I've told in a nutshell took quite a while, back and forth, holding meetings, looking at the documents, revising them, bringing in governments, because really government didn't want to lose control of the facility. It happened to be one of those in town, in quotes. And therefore, government needed to be able to tell the citizens that we are providing you this service.
Yeah, when I came, the health insurance scheme had already started. It was 1 year into the health insurance scheme when I came in. But I was told that before the health insurance scheme, what happened here was barely immunization services and 1 or 2 deliveries in a month. So when I came into 2011, Obio was then having about 80 deliveries in a month. And that have grown from then till now. We're having above 300 deliveries in a month. When I came then the staff then we were few. Then we were about 15 nurses and 6 doctors. But presently there are 69 nurses and 17 doctors.
Maybe it was not purposive when we started to look at how we will look. I think that was in the background. But I tell you, it's a new day for our company and for the people, because the story of Obio, I think, has changed the way we are perceived. We have a care agenda, and that's incontrovertible, and that has been for long. However, Obio has brought it to the fore. This was a facility that was seeing about 40 people per month. Today it sees over 10,000 per month. So under one roof, Shell, SPDC JV, the government of Rivers State, the people of these 5 communities of Rumu Ezolu, Oginegba, Rumu Obiakane, Rumu Masi, and all these communities have been able to come together to do something that begins to change our narrative as our country.
The health insurance scheme, it contributed to an extent to the increment in clientele base. That's because it's affordable. What will really keep people is the quality, the quality of care. I like the fact that the customer relationship program has really helped it to make them see it that it's not just that it's affordable. They are concerned about your satisfaction. They are concerned about the quality of care that you receive. They are concerned that you're getting value for your money.
In looking at the baseline, we now saw that increasingly the attendance at the facility was improving. Not just attendance, even the quality of care that the patients received was better. I'll give you a quick reason. Initially, there were no doctors in those facilities. All our PHCs were run by the people we call primary health care coordinators, mostly community health practitioners. And then we have a medical doctor in each LGA, whom we call the medical officer of health, who occasionally comes to the facility to run a clinic. It wasn't a regular clinic of Monday to Friday. So it was that kind of thing that was in existence prior to this project. But with this project now, there were now doctors there. So naturally, you expect an increase. More people were now attending because there was now confidence that there's skilled manpower to attend to them.
It has demonstrated very clearly that health insurance is doable.
It has done a lot of good to Rivers people, and the people are living in Rivers State also. So many people are coming from outside the state too.
I don't know the word to use for Obio. They are really good. They are doctors, they are nurses. They are too much. Too much. You know, most people will tell you, if you go to the hospital, if you don't give them money, they will not attend to you. It's not Obio. When I gave birth to my son, he was 1.6. I was so surprised. One day I was in my house. 2 doctors came to my house. Are you Mrs. Prime? I said yes. They said they are from Obio. They checked my baby, even without consultation fee, without anything. They checked me, checked everything, told me I'm okay. I'm fine, the baby is fine. They helped me to dress my baby. Checked, in fact, Obio, they are good.
Because of the positive work culture, the doctor will put in his best. The administrator, who is in charge of is it the health insurance scheme, will put in his best. The nurse will put in his best. The client relations officer will put in her best. You know, the lab will put in the best. And then, so the cleaner will put in her best. You know, the driver will put in their best. So that work culture brings out the best in everybody. And when they come together, they're able to produce the result that they are getting.
Most of our healthcare failures is actually out of poverty. You find out that the attendance is increased. People go more, the access is more. And with the access increasing, the delivery also improves because the health centers and the hospitals have more money to operate. So, I mean, without any doubt, it improves the healthcare system.
It offers an opportunity to also impart knowledge to the younger ones and also make sure that they are doing the correct things and we get to know who we have admitted as new patients. So that will take us for about 30, 45 minutes max, and then we go about doing our other duties.
I think the first one for me is that we've been able to show that homegrown solutions using our own resources, our own internally resources, Nigerian resources, our own national resources. Using our own growth solutions, we can make things work for us. Of course, I mean, we cannot exist in isolation. We need the so-called developmental partners. But we've been able to demonstrate that if we come together with one purpose, you know, they say your focus is your reality, and we are focused, we can make things work for people.
It's not always about resources, it's about resourcefulness. And for me, that is the underlying factor, because it's easy to take resources and throw at problems, but that doesn't solve the problem. Because truly this activity, the community has taken the driver's seat. This program cannot die because the people will not allow it. It's their own.
You know, we work together. The togetherness has made us, in carrying out our various duties. We don't really, if we feel we cannot do this, we can as well get the other person who can do it to do. So I think we work together as a team. So teamwork has been the one thing that's kept us going as Obio.
It's commitment. Commitment of the people who work there, both from our side and from the community side. Commitment of even the interns. You know, Obio for us is like everybody's baby in Shell and even the community. Everybody wants Obio to work. So every year we look for, you know, Nigerian experts in country who can help them. We send them there for their sabbaticals. We send people there as interns, and some bring fresh ideas. Some come there and test some of the studies they've carried out, and we've seen wonderful things happen because of that.
What has helped us is that we've not had undue interference from government, even from SPDC and the community. All we do is that we send reports and get advice from them. You know, if we want to do anything major, we get the advice, and they advise us, and we seek the advice, and we take the advice. You know, so if that undue interference has been there, Obio won't have been a success. So that is one of the major things.
Everything about them, from the nurses to even the cleaner. The cleaner will even take good care of you more than the doctor self. But they are very wonderful people.
For you to give adequate insurance like that, or adequate healthcare delivery, you have to optimize your facility. That is where the government and most times the private sector come in. so that in terms of the delivery aspect of it, they improve the ability to deliver. All right? So that's one. Two, most times before this thing starts, even to pay for capitation and registration, the average person, the average communities don't get to pay. So that's where for Obio, for example, the LGA came in and Shell came in to register and so on. So those things are key. Fantastic hospital, able to deliver good healthcare so that people would come. Somebody that will help register, and then the governance structure.
Effective management. The management structure is such that, it's almost airtight. It can't fail because everyone in management has a stake and nobody wants to drop the ball. So if you have a good structure where all the people in management have a stake and nobody wants to take the fall, it's going to run.
I think for me, the two critical things that have made the Obio scheme work, first and foremost, the ability of the staff and the team there to deliver good quality and efficient service. That is key because that continues to draw people either through insurance or fee for service. So the quality of that service, is been very, very, very key to the success of it. So I think a lot of kudos has got to go to the staff, the leadership, the president, the volunteers, all those, the sabbaticals, all those that have been involved in ensuring that that service is available to the users. The next critical piece is the community itself, because they've taken great ownership of it and they've protected it and they've ensured that the vision and the spirit for which it was set up is preserved. And I think that's equally important. I think those two critical factors are a bit. However, if you look at it, in terms of kickstarting all of this, Shell has played a critical role, because without the front loading, the capacity building, the necessary upgrades to make it an attractive service, the development of the governance structure, the support to the community, it would not even have started. So you cannot take that away, that without Shell's involvement at the outset and laying the foundations, the ability to lay solid foundations on which the community and the service providers have then built upon. For me, those are the critical factors.
Love, care. They care for people, no matter who you are, no matter where you're coming from.
So you must have a facility that can serve as a primary health center, providing basic minimum package of care. That's the first thing you must have.
So first of all, they should be well experienced. Experience, the number one. And they should pay attention to the staff. Everything that will support them in rendering the best kind of care should be given to the staff. Then thirdly, patient satisfaction is very key. You see the patient as key drivers in sustaining the program.
They should just follow us. There's nothing else. Follow us. We're doing well.
It's owned by the community. I know you talked to the traditional ruler. He owns that project, right? I mean, they own it. They tell you this is our Obio, right? So, and that's why it's sustainable. That's why it's working. That's why we get the progress and all the good things we are getting. So, for me, ownership is key. Two is commitment. Obio didn't just happen. Now we are celebrating the successes, but there were arguments, there were meetings, there were discussions around options. There were some bit of challenges that we had to overcome to make it happen. So, are you really committed to go the whole hog? Or do you get tired at the point and say, this Niger Delta is too difficult, let's just leave it? So we have to go through all that, learn from it, and then that's also another point. So ownership is key. Commitment is very, 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 very key also.
You must have, along with it, the quality of manpower that can effectively run it. Because one of the things that made us win that prize was that in each of the health facilities we had at the time, 350 of them, each one had a doctor, a midwife, and a community health practitioner. So when you have that combination, you have taken care of the maternal and child aspect which is essentially the first thing you do in a PHC. So it must have the correct combination of health manpower.
You also have to listen. I think we really did a lot of good listening to them. This is what we want. This is how it's going to be. So what you see there is a customized solution based on what they also think works for them.
The third essential thing is the community participation. The community must own it. They must say that we want this thing and we are prepared to put our money on it.
Another reason why the project succeeded was like zero tolerance for corruption. No pre quo quo. It didn't happen. Not even a cup of tea. That you can take to the bank, I'm telling you. So it was transparency at its best. Commitment, you could not doubt. It was there, you know. The will to succeed was there. And then the people's involvement was key.
Well, when you talk about reputation management, for us it's about three things. One is performance, so what you do. The second one is, of course, behavior, how you show up. The third one is communication, what we are trying to do now. So Obio for us is a very, very good example where those three have come together very well. So in terms of performance, we've delivered the facility. People go there every day. Each time you drive past there, it's full. That's what we want. Each time you go there, it's buzzing. It's full of activity. You go to your community and say, oh, we are going to Obio, you know, Shell's Obio facility, and you really feel good. So the performance is there because there's something that is working, that is creating value. Second one is the behavior. So also, if you know the story of Obio, it's about us listening to our stakeholders, working with the GMOU officials to say what really is important to you. How can we make it happen? What are the areas we can bring our own expertise, you know, to play in helping you get a sustainable outcome? It takes people who listen and who are humble enough to even go to a community man and say, how do you think we can do this well, you know, to make that happen? The third leg is that of communication, which is what we are doing now. So we've done it, it's working, we are telling people about it.
Building trust requires time, because it takes time to build trust. It also requires you to demonstrate consistency, that you're reliable, that you will do what you say you will do. So people can predict, you know, and that takes time as well. They need to have that experience again and again. But Shell was able to bridge that gap as well because it's a strong brand, it is known. And so people can trust that, look, if Shell is part of this, you know, they're not going to take our money away. You know, if I put my 10,000 naira into it, chances are that, you know, it's not just going to disappear. It will make money. So the reputation of Shell as a company, its governance structures, you know, and all those things come into play.
The first one on the list is the one at Obio, which was community, Shell, and government. Each person playing different roles. That one is the one that gave birth to the Rumokushi one, and the Mbodo Alu one. Now we've taken it one step further. We're starting one in Bonny and Abuloma. Those are the eggs that are going to give birth to the latest set of community health insurance schemes we're doing.
So we tried to pilot something in Kedere outside SPDC, because SPDC couldn't go to Ogoni area because of what was already field on ground. So we said, okay, let's go to Kedere, replicate what is happening in Rumokrusi without SPDC input and see how it goes. So we got the community to agree to set up themselves like a cooperative so that the premium will be an entirely community affair. The facility is there. If you raise sufficient premium to run this facility to the point where the facility becomes totally financially independent of government, then it becomes sustainable.
Before you can effectively discuss scale up, you need to have an understanding of the critical success factors, you know, that make something like this work. So you could say there are possibly three elements to it. There is the health insurance scheme itself, which is the pooling of funds to make this happen. You also need efficiently run and good quality health services, because people have to pay, to have confidence to pull money together to access the services. And thirdly, you need a critical mass of people who are committed and engaged and want to do this.
I think automatically all these micro schemes, let me put it that way, would have to somehow integrate into that one. Either you're going to use blocks, community blocks or whatever. Those are things that will work out later when the thing starts. Do you understand? So we can register our own health centers as a block and say this is where we are. So this is the people we're playing with. These are the funds that we've basketed, or these are the funds where we have. So these are the ones we're providing into the state-owned one. But those are things that we can't talk about now. Let them come on stream, let them set up. Once it starts, the way others will plug in will be obvious.
But when it comes to integration, frankly, you cannot have multiple insurance schemes for the same population. It's like paying tax twice. So I can't insure, if I have a property, I can't insure it more than once because it doesn't make sense. So in a way, the expectation is that, the community health insurance schemes, if the state insurance schemes become efficient, fit for purpose, and deliver the value expected, they should be subsumed, ultimately. So they just, in my opinion, fill in a gap in the short term until we get it together.
Yes, so my wish for Obio, if I can see 8 new Obios coming up, following the template and being a force for good, that will have been. So we have Obio in Kolo coming up. Then we will not just be relying on government alone. Everybody will have been able to bring his own complementary strengths into place.
My wish for Obio is that Obio should continue to grow, that the government should support the good work that is being done here, because there are still some constraints that is beyond us. It's not something the Chief Medical Director can do. We're just managing it like that. So however the government can support.
My vision for Obio is not an expansion of Obio within the premises where it exists, but rather a replication of Obio across the different strata of the different communities around River State.
I wish them the best of life. I wish them more good things, because seriously, I don't know the word I will use to qualify Obio. The doctors and nurses, they are like angels sent from above. So I wish them more ability to execute their plans, more plans in future.
My wish for Obio is to go beyond the mother and child hospital and do other things. Have a full-fledged surgical ward, have a full-fledged radiological center, and these are areas that we can go in, that can sustain the place, because you need funds to sustain the place.
The scheme has overgrown the facility. We should think of how we're going to spread it to Woji, which is the Woji Health Center, which is the nearest to it.
I want them to grow more bigger, more large. If it's possible, they should get another land to expand it. If they will see around the community, but I don't know if it's possible for them, because I don't want them to go far from us.
Obios, they are doing well if they continue to do what they are doing, and they also continue to imbibe this continuous improvement process.
My wish, really, is that it will continue to grow from strength to strength. I don't know how long SPDC will continue to support the scheme. But if I were SPDC, I will begin to shed load a little by little, so that over the years, the community will not even notice my total exit, so that if tomorrow I'm not there, it will not collapse.
My wish is actually not for this Obio, it's for more Obios. I'm a Nigerian Niger Delta, and I think if we can replicate this, and one company cannot do it. So if as a government, if as a people, if as Nigerians, we just say, let's create other Obios all across this beautiful country, I'll be so happy, because that's going to really change the game in terms of achieving SDG 3, and we really need to achieve that. So let's go get more Obios all over the country. That will be my biggest wish in this space.
I think my one big wish for Obio is that for it to continue to be a model for others to copy and to replicate. So for it to maintain the quality of its services, the efficiency, the ownership, and to strongly support the replication of what it has done. So my wish is that, we will have enough Obios in the Port Harcourt or River State generally, that that approach, the quality of service and the approach becomes the norm. So we reach a critical tipping point that the market, the healthcare market in the States, reflects the ethos, and the qualities of the cottage hospital, as well as the way, the transparency, the governance, and the support that's been provided.